Hi, Mr. Walker. I am Melissa. I'll be your nurse today. So what brings you in today?
Well, I was eating lunch and I just started getting a really bad headache, so I got up to go lay down and I just felt really weak and felt like I couldn't walk very well. It felt like my legs weren't working like they should.
Okay. And is it more on one leg than the other? Or?
Yeah, I felt like my right leg was really having trouble keeping up.
Okay. All right. And you said, did you say you had a headache?
Really bad headache.
Really bad headache? Okay. Okay, so I'm going to do a test, a stroke scale test, to see how severe, if you have had a stroke and how severe it is. Okay, so I'm going to ask you a couple of questions first.
Okay.
Do you know what month it is?
June.
June. Okay, good. And do you know how old you are?
67.
Okay, good. All right, and I'm going to have you do some, just follow my command, okay? So I want you to close your eyes, shut them tightly, open them, close them again, open them, okay, good. And then make a fist with both hands, open them, close them, open them, okay, good. All right. And now I am going to check your vision. Okay? So I'm going to have you follow my finger. Okay, good. Alright. So I'm going to have you smile next, okay? Just show me your teeth. Big smile. Okay, good. Okay. You have a little bit of weakness on that right side that I saw, okay?
Oh, okay.
Alright. Now I'm going to have you move your arms and legs for me. So it's going to be one arm, one leg at a time. So start with your left. Hold up your arm and try to hold it there for 10 seconds. Right? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. Alright, now if you can do your right arm, same thing. Ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. Now with your left leg, what's that?
It was weak.
Weak, yeah. So let's see. Well, now with your left leg, let's see if we can do 1, 2, 3, 4, 5. Okay, good. You only need to hold it for 5 seconds. Now let's see if you can do it with your right leg there. Can you move your right leg for me? Yeah? Let me help you. Okay, I'll hold it up. Okay, I'm going to let it go. Try to hold it there for 5 seconds.
Okay.
What? Okay. Not at all? Okay. That's okay. All right. Let's see. Okay, and now I am going to have you follow my commands, okay?
Okay.
So I want you to touch my finger with your left hand there. Now touch it, point it to your nose. To your nose. Okay, to my finger. To your nose. Good. Alright, now if you can do it, can you do it to your right hand? Okay, and to your nose. Okay. Okay, to your nose again. Okay. Alright. And then, let's see. I'm going to hold up some fingers here. You're going to tell me how many fingers I'm holding up. I'm going to hold up some fingers. You're going to tell me how many fingers I'm holding up while you cover one eye at a time, okay?
Okay.
Alright, we're going to start with your left eye. So go ahead and cover your right eye. Alright. Okay, ready? How many hands or fingers?
2.
How many fingers?
5.
Alright. Again?
1.
Okay.
5.
Okay. Alright. Let's do it to your other eye. Alright. Okay. Ready? How many fingers?
2.
Okay. How many?
2,
Okay.
3, 4.
Okay. Alright, and now I'm going to check your sensory sensations. I'm going to touch your arms and your legs and see if you feel me, okay?
Okay.
Alright. Do you feel this?
Mhm.
Okay. Do you feel that?
Yeah.
Okay. Do you feel this?
Yeah.
Do you feel that?
Little.
Okay. Now on your legs. You feel this?
Uh huh.
You feel that?
No.
No? You feel this?
Yeah.
You feel that?
No.
Okay. Alright. And do you live at home by yourself?
No.
No? Who do you live with?
My wife was a total babe.
No. Okay, and now if you're going to need some help when you go home, depending on how well you walk and move around, able to do your daily activities, do you think you'll need some assistance, maybe some home health?
No. She'll be okay.
Okay. Alright, well we'll evaluate that again throughout this your stay here at the hospital, see if you change your mind by then. Now with the stroke we're going to see if you have any bleeding, so the doctor I'm sure is going to order some imaging and we want to get those done pretty quickly.
Okay.
Therapy that they usually do for strokes is a blood thinner itself, so we want to identify if it's an active bleed or if it's what they call an ischemic stroke, which is just where you have a blockage in there but it's not bleeding.
Okay.
Okay, the treatment will be a little bit different.
Okay.
Okay, is there any questions at all that you have?
No.
Okay, and do you have a power of, or a living will or a power of attorney?
Yes.
You do? Okay, and do we have that on file?
Yes.
Okay, and if we are, for some reason, if you stop breathing or your heart stops, would you like us to resuscitate you?
Yes.
Okay. All right, Mr. Walker. I'm just going to do a quick assessment, listen to your lungs and your heart, okay?
Okay.
Now, have you had any stomach issues, anything at all? Did you, are you able to pee just fine?
Yeah.
Okay.
Everything was okay.
And when all the symptoms came about, did you have any nausea or vomiting?
No.
And what time exactly did those symptoms come about?
I was eating lunch about noon and my head just started hurting really bad.
Okay. And your head still hurts pretty bad?
Yeah.
Okay. All right. Take a listen here. Breathe normal. Okay. And do you have any significant health history, any cardiac history or high blood pressure?
High blood pressure and cholesterol.
Okay.
High cholesterol.
And do you take medicines for that?
Yes.
For high blood pressure?
Yes.
Okay. And cholesterol?
Supposed to eat good.
Okay. So by diet you've been trying to do?
Yeah.
Okay. Okay, Mr. Walker. Well, the physician should be in soon.
Okay.
And I'll see what he orders, and then I'll be in shortly after him, okay?
Okay.
Alright, is there anything I can do for you right now?
No, ma'am.
Okay. I'll be back.
Okay.